the modes of presentation, and also advise them on how to abrogate certain practices, cultural practices that are inimical to, that sort of aids and abates the transmission of this illness. Show that there is high level of hygiene within the environment. We know that some people, it's part of their practice that they feed on rats. The problem here is ability to identify which rat that has Lassa fever, which is very difficult, and which one that is free. And during the course of preparing such rats, before they are boiled and cooked and all those, contact with the fluid coming within them, we know that this illness is transmitted by Mastomys natalensis, which is a class of rats that's called multi-membrane rats. So if we're able to achieve all this, and in addition, ensure that there is high interpersonal and environmental hygiene within our hinterlands and entire country, then we know that care at primary level is secured. Then we have to move on to care at secondary level, which I will identify as making sure that we have serviceable centers, serviceable diagnostic health research centers that are cited, especially within the zones, endemic zones of this illness. We know that the Irua-Ekpoma axis, Abakaliki axis, and you come up to the north central here. Now this illness, comes in waves. It's almost like it comes without season now, almost on yearly basis. It is there. So we ensure that we have these serviceable centers sited in these areas and actually aim at the 6 geopolitical zones in the country to have this. And such serviceable centers will make sure that they are well equipped with diagnostic equipments that will help in identification and prompt treatment of this illness. And also, they should be charged with responsibility of carrying out researches, just as it's being done in Irua Specialist Teaching Hospital today, in such centers, which is aimed at seeing to end this illness and identifying the things that we really need to say bye-bye finally to the illness. So, and that will lead us to the tertiary, which is the last level of care, which the government is advised to be focused on, one, seeing how we can come up with rapid diagnostic kits, because time is of essence in managing this illness. If we're able to develop rapid diagnostic kits, as we have today in malaria management, whereby within seconds, just a drop of the fluid from the suspected case will be able to a reasonable level, help us in making diagnosis, that will be very, very good. And finally, to look at ways of getting a very efficient and safe vaccine, until Lassa virus vaccine.
Prof, can I quickly chip this in? Let me quickly chip this question in. You spoke about rapid diagnostic tests. Can you explain to us why the Center for Disease Control is harping so much on rapid diagnostic tests for malaria? I mean, talking about Lassa fever, what's the connection?
Yeah, it took a little while before we come up with a rapid diagnostic kit for malaria, which the sensitivity and the specificity is highly acceptable in the scientific world, and today is helping so that within your confine, anywhere you find yourself, you can easily diagnose malaria with just having a droplet of blood on the kit, and you see some changes that will tell you that it is positive or is negative. If we have such a diagnostic rapid kit developed for Lassa fever, you realize that referring patients from primary centers where this case is being suspected to places like Irua, where you have to travel kilometers, and time is very important, I will be able to curtail this. And in any comprehensive center, we'll be able to test any patient that we are suspecting of having Lassa fever. And once you have that red flag that it is possible that there is Lassa fever, necessary information will be passed on and containment processes will start. In so doing, you will see that the chances of rapid spread of any outbreak within, that it will be easy to identify cases and also contain them, even before the development of vaccine, which is actually what I think will be the highest level of echelon, because this can easily be incorporated into the immunization process in the land. Both children and adults will have a shot of this immunization, and we are sure that people will be protected. And when we were able to implement all these various stages of moving towards total eradication of Lassa fever, we'll see that it's just a question of time. And we'll not only be able to contain the disease, but we'll be able to eradicate it within. Drugs should also be made available across board in primary, secondary, and tertiary healthcare, not just only the serviceable diagnostic centers. Ribavirin, as we know, which is a very effective drug of choice, if given within the first 1 week of contacting the disease and manifestation of the symptom, we know that there are over 90% chance of having cure if this is done.
Okay, Prof, thank you very much for being with us this morning. We appreciate you. That was Professor Titus Ibekwe, a researcher in medicine at University of Abuja. Thanks for being with us.